Welcome. Today, we're shedding light on a rare and complex condition, neurofibromatosis-associated interstitial lung disease, or NF-ILD. This is a specific type of lung disease that occurs in individuals who have neurofibromatosis, a genetic disorder affecting nerve tissue growth. Understanding FLD is crucial for early diagnosis, effective management, and ultimately, improving the lives of those affected. The exact causes of NF-ILD are still being researched, but we do know it's linked to neurofibromatosis, specifically type 1 or NF1. NF1 is caused by a mutation in the NF1 gene, which provides instructions for making a protein called neurofibromin. This protein helps regulate cell growth. When the gene is mutated, it can lead to uncontrolled cell growth, resulting in tumors called neurofibromas. While these tumors rarely directly affect the lungs, NF1 is believed to trigger an abnormal inflammatory response in the lungs, leading to lung tissue damage and scarring. Genetic predisposition, along with potentially environmental factors, are thought to play a role in the development of FILD within the context of NF1. The pathophysiology of FILD is complex and not fully understood. It involves chronic inflammation within the lung tissue, specifically the interstitium, the space between the air sacs. This inflammation leads to the accumulation of immune cells, like lymphocytes and macrophages, and the release of inflammatory mediators. Over time, this chronic inflammation causes fibrosis, or scarring of the lung tissue. This scarring thickens the walls of the air sacs, making it harder for oxygen to pass into the bloodstream. The impaired gas exchange leads to shortness of breath and other respiratory problems that are characteristic of NF-ILD. The underlying mechanism linking F1 to this inflammatory process is an active area of research, but likely involves dysregulation of immune cell function. NF-ILD is a relatively rare complication of neurofibromatosis type 1. It's estimated that a small percentage of individuals with NF1 will develop clinically significant ILD. Because NF1 is a genetic disorder, it affects people of all races and ethnicities equally. However, the prevalence of NLD can vary depending on the diagnostic criteria used and the population studied. Due to its rarity, data on specific incidence and prevalence rates are limited, and further research is needed to better understand its epidemiology. The signs and symptoms of NF-ILD can be subtle initially and gradually worsen over time. The most common symptom is shortness of breath, especially with exertion. This may be accompanied by a dry cough, which doesn't produce any mucus. Other symptoms can include fatigue, chest discomfort, and in some cases, clubbing of the fingers or toes, a widening and rounding of the fingertips. These symptoms can overlap with other lung conditions, making early diagnosis challenging. It's important to remember that not everyone with NF1 will develop these symptoms, and their presence doesn't automatically confirm FILD. Diagnosing FILD involves a combination of factors. First, a thorough medical history and physical exam are essential, particularly looking for signs of neurofibromatosis type 1, such as skin lesions called CAFI, late spots in neurofibromas. Pulmonary function tests, or PFTs, are used to assess lung capacity and airflow. These tests can show restrictive lung disease, meaning the lungs can't expand fully. High-resolution computed tomography, or HCT, of the chest is a crucial imaging technique that can reveal characteristic patterns of interstitial lung disease, such as ground glass opacities, honeycombing, and traction bronchiectasis. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other possible causes of ILD. A multidisciplinary approach, involving pulmonologists, radiologists, and geneticists, is often crucial for accurate diagnosis. While NF-ILD isn't typically classified into distinct subtypes like some other ILDs, it's important to note that the severity of lung involvement can vary significantly from person to person. Some individuals may have mild disease with minimal symptoms, while others may experience progressive and debilitating lung dysfunction. The pattern of lung abnormalities seen on HRCT scans can also vary, but more research is needed to understand how these patterns relate to disease progression and treatment response. Unfortunately, there is no cure for NF-ILD. Treatment focuses on managing symptoms, slowing disease progression, and improving quality of life. This often involves a combination of approaches. Corticosteroids and other immunosuppressant medications may be used to reduce inflammation in the lungs. Pulmonary rehabilitation, including exercise training and breathing techniques, can help improve lung function and endurance. Oxygen therapy may be necessary to supplement oxygen levels in the blood. In severe cases, lung transplantation may be considered as a last resort. Ongoing monitoring and supportive care are crucial for managing the disease effectively. It is important to note that antifibrotic medications, used in other forms of ILD, are used in FILD as well to combat lung damage. Currently, there is no known way to prevent FILD in individuals with neurofibromatosis type 1. Because NF1 is a genetic disorder, Genetic counseling is recommended for individuals with NF1 who are planning to have children. Early detection and management of NF/ILD are crucial for slowing disease progression and improving outcomes. This includes regular monitoring of lung function and prompt treatment of any respiratory symptoms. The prognosis of NF/ILD can vary considerably depending on the severity of the disease, the individual's overall health, and their response to treatment. Some individuals may experience slow disease progression and maintain relatively stable lung function for many years, while others may experience more rapid decline. Regular monitoring by a pulmonologist is essential to track disease progression and adjust treatment as needed. Ongoing research is focused on understanding the underlying mechanisms in NF/ILD and developing more effective therapies. Some recent studies have investigated the potential role of antifibrotic drugs, which have shown promise in treating other forms of ILD, in slowing the progression of NF/ILD. Clinical trials are essential for evaluating new treatments and improving the lives of individuals with this challenging condition.